Welcome to Stethoscopes and Student Standpoints, the official podcast of the Alberta Medical Association, AMA, Medical Students Advocacy Committee, and the first ever inter-school podcast led by medical students in Alberta. My name is Sana.
And I'm Abdullahi.
So let's get into today's episode. So today we're going to be talking about oncology wait times, and this episode has been written in collaboration with a University of Calgary student, Caden Jobin, and has been edited by Abdullahi and I.
Cancer affects nearly 40% of Canadians over their lifetime. And with a growing number of cancer diagnoses, wait times in Alberta to see an oncologist have extended to around 13 weeks in some cases. The target is ideally 4 weeks. And when we're dealing with a diagnosis as serious as cancer, every week matters.
And I'm sure it's obvious why we want to get them in as fast as possible. But looking at the research, we see that studies have shown that about a 4-week delay in treatment can cause increased mortality by about 6 to 13%. So that's not just numbers, and it's time patients could spend with loved ones and used to plan their care. And we're also seeing that these later stage presentations put more pressure on cancer care teams, increasing workload and potentially making oncology harder for future trainees looking into it.
If you or someone you love has faced a cancer diagnosis, you know that every day of waiting can feel like a lifetime. In Alberta, wait times for imaging, specialist consults, and treatment can extend well beyond national benchmarks, and this can deeply affect outcomes. With cancer care, the challenge is multi-layered. On one hand, we're seeing rising demand without the supply or staffing to meet these demands. So as medical students, one thing we can do is look at this from an advocacy capacity and ask ourselves, what can we do to help make this change going forward?
Yeah, and this is really tough to talk about because it's not the fault of any one group. It's obviously the physicians, the oncologists are trying to help and are doing the best in their capacity. So it's definitely a systems issue, and it's really like any complex healthcare problem. It requires really thoughtful, collaborative solutions that include the voices of everyone, which is kind of what Abdullahi is getting at there. We need to have unison between the medical students, the providers, the patients, and the policymakers. And advocacy here is really important in trying to get more funding and resources for oncology in order to help this.
According to the Canadian Partnership Against Cancer, Alberta currently ranks lower than other provinces in timely access to radiation and systemic therapy. Some patients are waiting 6 to 8 weeks or longer after diagnosis just to see an oncologist.
Exactly, and these delays aren't just inconvenient, they can influence prognoses as we've been talking about. So we want to emphasize that Alberta's cancer care system is full of dedicated professionals who are doing their best in this really complex and evolving environment. And that being said, what are these systemic constraints? I'm sure everybody agrees, even the policymakers, that, yeah, we need better cancer care, but why can't we get it? So a growing cancer burden means increased demand for diagnoses, staging, oncology consults, and sometimes capacity hasn't scaled in time to meet it.
And it's not just oncologists that are involved in managing cancer care. There's actually a lot of different specialties involved and a big healthcare team. There are delays in imaging, pathology, or biopsies that can delay the entire process. And these aren't intentional delays. It's more of we're already working at full capacity, doing the best that we can. And oftentimes, patients can't even be referred until their workup is complete, until they have their imagings, pathology reports, and biopsies complete. So waiting starts much earlier than we think.
Exactly. And all of this is really important because, like Abdullahi highlighted, this is a systems restructuring and funding that needs to go into it, not just the sector of oncology necessarily, but also in imaging and pathology and all of those. So Alberta's healthcare system is really complex, and like any other healthcare system, it's navigating workforce turnover, physician burnout, resource constraints, and all of this can actually affect care continuity. And these challenges aren't unique to us, obviously, but they do highlight the need for a system-level innovation and collaborative problem solving.
And so just to take a step back from talking about all this big picture stuff, I guess the most important thing to take away from today's episode as a student is, what can we actually do? right? And so as students, we're not just passive observers, we can be part of the solution. And the first step, I think, is advocating for increased exposure to oncology within pre-clerkship, whether that's through electives, shadowing, or research. And early interest can lead to long-term recruitment into the specialty. And I know at the U of A, and I think at the University of Calgary as well, we have oncology interest groups and clubs. And at least here at the U of A, they've been doing a great job in getting that exposure and that early interest to students in pre-clerkship. Even before we get to do oncology block, we get to know what it is, and we get to get talks from oncologists and radiation oncologists who really tell us about that specialty and give us that exposure early on and help students nurture and develop a passion for this specialty.
Exactly. And just to talk about something more U of A specific, so we have, Abdullahi and I are both from the University of Alberta, like we said in the beginning of the episode, but we have our oncology block as the very last block of pre-clerkship before we get into working in the hospital. And honestly, I thought it was a fantastic block. I personally hadn't thought too much about going into oncology necessarily, but this block really opened my eyes to how complex and how diverse the field is. And something that I remember from class that really stuck with me was, as clerks, so the third and fourth year students working in the hospitals, we have this really unique advantage in that we're so early in our training that we have a little bit more time than those physicians to spend with the patients. So especially in oncology, it can really make a difference just listening to the patients, just being there for them. And as a clerk, spending that extra time and knowing the systemic issues with oncology and the frustrations that patients may have before even entering the system, and showing a knowledge just on the overall system can be really important to talking to patients.
Yeah, I completely agree. And this just goes back to how well done our oncology block was. We really had those discussions on what can we do to provide holistic care to patients outside of just the medicine and the prescribing. And we had important discussions around how cancer diagnosis can affect someone's sexual health. How can we better support Indigenous patients and incorporate a more holistic and culturally appropriate and sensitive type of care? How can we involve traditional Indigenous healing methods into the care we're providing to our patients?
Exactly. Especially as non-Indigenous providers, we want to be providing good care to our Indigenous patients as well. So that was a really insightful conversation and a really good lecture that I'm glad we got from an Indigenous individual educating us about the systemic issues and how we can help at our level. So to talk a little bit more about our oncology block specifically, we actually had another lecture on alternative therapies. I loved this lecture. It was really interesting. We know that a lot of patients like to do things like acupuncture and saunaing. And as care providers, we need to be definitely educated on doing that in conjunction with medical treatments and supporting patients and giving evidence-based information, as well as understanding that there are perhaps things that are not so evidence-based but make the patient feel better otherwise and is important to support.
Yeah, and I guess the biggest takeaway from that was, even though during that block I felt it was the most I ever knew about medicine, because it really did well to combine different things from all the different blocks we learned about, I guess one of the most important lessons I took away from it was having a patient-centered approach and understanding that the most important person in the room at any given moment in time is the person sitting in front of you. It's your patient and their comfort and their needs.
Absolutely. Yeah, and at least at the U of A, it's our very last block, and we're in the block system. So essentially we have a block for each topic. So we have renal, and we have cardio, and we have pulmonary, and oncology was our last one. And it was really great as pre-clerks to finally feel like we understand medicine to some level. It's very humbling being in pre-clerkship because there's just so much you don't know. And of course, that's the nature of medicine, but there's a lot we don't know at the pre-clerk level. So it was really nice to consolidate the information, because oncology, like we said before, and the reason why there are systemic issues with oncology, because just as a field, it is so multidisciplinary. And they really got that across through our lectures. Each lecture they gave us, for example, for lung cancer or for breast cancer, it was done by a panel of physicians, which isn't something that's that's really done for our other lectures. There are medical oncologists and radiation oncologists and even internists and just this whole team that would discuss in these huge 3-hour lectures about how they work together. And we really realized how multidisciplinary it is in oncology, which makes it a little bit unique. And of course, other fields, of course, have multidisciplinary efforts, but it's really shown in oncology for sure.
Yeah, definitely.
So this brings us to, let's talk more about advocacy here. Abdullahi, can you tell us a little bit more about what students can do and what perhaps organizations there are to help support?
Yeah. So we discussed earlier at the school level, getting involved with the interest group or the oncology club. There are also advocacy organizations that students can support that push for improvements in access and care. Groups like Kidney Cancer Canada, which connect patients with peer support, resources, and help them navigate the system during wait periods.
And let's not underestimate the value of peer and community engagement. So I think a lot of medical students, of course, the majority of medical students are not going to be oncologists. And while we really are pushing for more oncologists in the field, and there is quite competitive programs across Canada and in Alberta today for oncology, we think it's important for really all fields to know about oncology. And that's something that really got pushed across in our oncology block, that we all need to have a base understanding of oncology, because the primary care setting, of course, deals with it. And there's oncological crises that end up in acute care, so emergency physicians see it. And there's people with other health problems in addition to their cancers, so internists will see it. And all of that can just continue over and over again. So there's so many different physician types that need to be educated and know oncology. At the medical student level, it can be really, really beneficial to just really engage with oncology and try your best to learn and maybe even take an oncology elective, even if you're not thinking of being an oncologist, just because of that importance there.
And so just to gather together our final thoughts, we've talked today about wait times, yes, but more importantly, we've talked about what we can do as students, where we're uniquely positioned to ask questions, build interest, and amplify solutions. And Alberta has the potential to be a leader in this space.
So if you're a student listening, we really encourage you to join an oncology interest group, support an advocacy organization, start a project that helps make the cancer journey better for patients, or just really educating yourself about oncology and making an extra effort to talk to patients with cancer and putting that time in for them, where potentially that could really help with how they feel about the whole process. And really any effort matters.
So that's it for today's episode of Stethoscopes and Student Standpoints, the official podcast of the AMA Medical Students Advocacy Committee. If you found this discussion insightful, make sure to subscribe and follow us for more conversation on medical education, advocacy, and healthcare reform.
And like we said before, this is the first inter-school podcast led by medical students in Alberta, and we want to hear from you. If you have a topic you want us to cover, please reach out. We'd love to keep the conversation going.